Hello, hello all. In this presentation of mine, I'll be speaking about an interesting topic that is related to my field study. Therefore, for today's topic, I'll be discussing dysphagia by me, Marcia Argueta. Let's talk about how the disorder dysphagia will be an interesting topic for my presentation. This is my nephew, Justin Rosario. I would like to say he is the most useful blessing. I never realized that being on at the age of 8 would help me develop a philosophy of kindness and willingness to help others in the world. I have saved his life, and from the day I saved my nephew's life was when mine changed forever. My first nephew, Justin, was born with a health condition where he forgets to breathe in his sleep. He stayed in the hospital during his first 3 months. 3 to 5 months. A doctor made a hole in his throat using a needle before inserting a tube in the opening. As you can see, he has a breathing tube in his throat in this picture. And a person that is needed to have a breathing tube may have carried out to needing enough oxygen to the lungs where they're unable to breathe normally, as it helps the person to breathe when their throat is blocked to something that is stuck in the throat or swelling due to swelling. Who knows? Therefore, Justin has a breathing tube where a machine with oxygen can help him breathe during his sleep. However, even though Justin was put to have a tube in his throat to help him breathe when he sleeps, he was also diagnosed with dysphagia. But I would like to tell a story of how Justin made me realize that being a speech language pathology was a perfect choice to be for my career. Justin has completely changed my life for the better. I would like to state a story that made me realize, wow, this is what I really wanted to be. I remember one night I decided to babysit my nephew Justin. I was asleep as well. He was, and I decided to babysit as my family went out to eat. And we were in a hotel resort. I remember there was a beeping constantly repeating in my head. I thought it was my alarm going off in my sleep, but I then remember it was summer vacation. I'm not in school. I'm in a hotel resort, so why is my alarm going off? As I asked myself. The baby keeps ringing as I finally realized it was Justin's oxygen machine. I woke up, ran to the bed that he was sleeping in, and I see his face was turning blue. I remember that my heart was beating so fast. My hands started to sweat. My forehead was sweating a lot. I quickly started to shake Justin up, trying my best to keep him awake. It was 2 a.m, so I know that he didn't have the full energy to wake up. I quickly turned off the oxygen machine because it was making me nervous. I asked myself, how will I do this? I am not a nurse. I'm not a doctor. So how would I save his life? I asked myself that. He wasn't awake, but I just get more nervous as I see his face turning more bluer than ever. No one was there at the time as I was alone babysitting him. I was just a scared 14-year-old girl who decided to babysit him for the night. It wouldn't go in. The breathing tube of his wouldn't go in at first as I yelled, "Please stay with me." It took multiple tries to put the breathing tube inside, as finally the breathing tube went inside in his throat, and I quickly turned on the oxygen machine so that Justin can have his oxygen back to normal. I remember I did this. I felt this amazing relief afterwards. I remember this words he said right after I put his machine back. He said, "Auntie, I'm okay," as he smiled at me. I remember I wiped my tears and I looked at this precious angel that changed my life for the better.
It's 11 o'clock.
And because of him, he's the reason why I want to become an SLP. What is a speech language pathology, as you may ask? Oh my God, I'm so sorry. They are known as SLP, who works with people of all ages, from babies to adults. They are sometimes called speech therapists. Speech language pathology assess, treat, diagnose, and help to prevent communication and swallowing disorders in children and adults. They get to diagnose, people with speech, communication, language, and swallowing disorders. They provide training and education to family and caregivers and other professionals. Speech language pathologists, they provide rehabilitation for individuals who are deaf or are hard of hearing as well. And they tend to work with people who don't have speech or swallowing disorders or language, but want to make a change in other people's lives by teaching those who need to communicate more effectively. They are there to help people who want to have their communication more better, just making changes in other people's lives. I did learn that the willingness of helping others is the best thing to do. I know that caring about others is so important for me. I am known as a girl who loves helping people no matter what the situation is. Because of Justin, being a speech language pathology is my dream job. I noticed that helping others can lead me to being very successful, because when helping others, you can make a difference in the lives of others. It gives me the opportunity to positively impact others in the community, which I truly love to see myself. As you can see, one of the disorders that speech language pathologists get to treat on people is dysphagia. What is dysphagia, as you may ask? Dysphagia is the sensation of this difficulty with swallowing and feeding. It's when a person or patient takes time and effort to move food on the liquid or the liquid itself from their mouth to the stomach. I would say they're very slow when it comes to eating their food or their liquid from their mouth to the stomach. As you may know, this type of disorder can be very stressful and very painful. It's not an easy disorder at all. It can be very stressful. This can lead to very serious medical condition requiring a treatment. Dysphagia can occur at any age, but is more common in adults. The symptoms of dysphagia. There are many symptoms of dysphagia. Each person are very different, but here are some of the common symptoms of this disorder. Coughing during eating or right after eating or drinking. When a patient feels the pain while swallowing food, or when a patient has the inability to swallow. When a patient has extra effort or time to need it to chew or swallow their food or liquid, or when the food or liquid leaking from the person's mouth. Weight loss can also be a part of the symptoms due to not being able to eat enough. When diagnosed with a disorder, the healthcare provider will most likely ask you of your background history of your swallowing difficulties, as many tests will be performed to find the cause of the problem. There are treatment of dysphagia. The treatment of dysphagia is managed by a group of professionals, which mostly include speech language pathology or dietitians. However, this treatment is normally performed by speech language pathologists. They will test patients with dysphagia by making sure to have the patients modify barium swallow study. So as you can see, barium swallow study is when a patient eat or drink food or liquid with barium in it. So after the patient drink food or liquid with barium in it, the professional will view the swallowing process on an X-ray. Another test is the endoscope assessment. This assessment is used on a laryngoscope, which is inserted through the nose as the swallowing process is viewed on the screen by a SLP. An SLP will have many different strategies to help the patient swallow more effectively. They will get to teach the patient certain learning exercises that might help with the swallowing muscles. That they will offer the patient specific food and liquid textures that are easier and safer to swallow. There are many causes of dysphagia. The many causes of dysphagia, it could be from stroke, brain tumors, may come from learning disabilities and a cleft lip and a palate. Feeding tubes. This slide is very special. The reason why is because Justin had a feeding tube. When Justin was diagnosed with dysphagia, he was 6 months old. Right after the doctors knew that he has a health condition where he forgets to breathe in his sleep, they decided to insert a tube by making a hole in his throat. But after that, he was also put to have a feeding tube. A feeding tube is a medical device that is used to feed an individual who is unable to not take food by mouth safely, and Justin was one of them. Justin had a G tube. I remember it's a G tube. It's a type of tube allows for direct access to the stomach through an incision in the left upper side of the abdomen. This tube completely bypasses the mouth and throat and allows for the food and fluids and medication to be given without swallowing. He was given several learning exercises and feeding techniques to swallow better. However, he had a very special SLP. To this day, I will very cherish her because the way she changed my nephew's life for the better, and because of her, that is the reason why I want to become an SLP as well, because of her and Justin. As you can see, this is him now. Justin is now 12 years old, very healthy, living his life just like a normal little boy. He loves to play video games with his friend and myself as well. He loves to read books on his free time as well. At 12 years old, Justin still has the health condition where he still has the throat in his tube, uses an oxygen machine to help him breathe in his sleep. However, he is not diagnosed with dysphagia as he recovered from it. He now can eat and swallow safely with no need of help. Thanks to the speech pathologists and other medical professionals, they truly helped him. I will forever cherish them and their help. I had never imagined becoming an aunt would change me into the person that I am today. From the day I saved his life, I knew the word kindness was an important character trait. I learned that it is important to be kind to others because at the end of the day, the way that a person acts towards others can impact their life in a positive way. So, therefore, thanks to my beautiful nephew, he is the reason why I want to make a change and difference in the lives of others. Because of the learning experience I had with my nephew Justin, I became the person I am today and decided to become a person who can save other lives in the future. Thanks to you, my little Justin. This is the reason why I'm doing this slide, just for you and for others who were or are diagnosed with dysphagia. This is a presentation to show that dysphagia, you can still live your life no matter what. You're still normal. You're still a human being. And you are perfect no matter what. But at the end of the day, nobody's perfect. No life is perfect. And this is my informative presentation. These are my references. And thank you for listening to my presentation by Marcia Argueta.